is Andronique Noel, and I'm going to discuss COVID-19 and gestational diabetes in African American women with comorbidity obesity. So, my target audience is African American women living within the United States. The target age is women aged 25 and older, and I'm focusing specifically on women with gestational diabetes and comorbidity obesity. This target audience was chosen based on the recent incidents and high mortality rates of Black women within America who are pregnant and have lost a child during childbirth, or they have themselves passed away during childbirth. Additionally, due to the inadequate services provided within hospitals or from genetic predispositions such as gestational diabetes. So, just a little bit of information on diabetes. Diabetes is a chronic condition that deals with high levels of sugar levels within the blood. This is the top 10 leading cases of deaths within the United States. It is ranked number 7 specifically. Elevated glucose levels are a result of the hormone insulin not being produced enough, or it is being produced and the body is not recognizing the levels of insulin available. This hormone is regulated and released from the pancreas, causing increased blood levels from children all the way to adulthood. There are 3 types of diabetes: type 1, type 2, and gestational. Diabetes can cause additional comorbidities or severe issues such as hypertension, obesity, coronary heart disease, myocardial infarction, stroke, congestive heart failure, and kidney failure. Type 1 and type 2 diabetes are more common amongst children and adults, and just some information about each. Type 1 diabetes is an autoimmune reaction. It is a genetic condition specifically affecting children, teens, and young adults, and is also known as juvenile diabetes. It is an early onset. It can be seen in children from as early as 5, and the symptoms are very developed very quickly. This, unfortunately, is an unpreventable disease and continues to persist throughout the lifespan of the child. Type 2 diabetes is an insufficient use of insulin and is generally caused by behavioral modifiable risk factors. This is a chronic condition affecting adults, and it does have an asymptomatic phase where many who are pre-diabetic or on a track to being diabetic are not aware that they have diabetes and cannot see symptoms until later on within the life. Gestational diabetes, which is my target audience, is a time-specific condition. It is not a chronic condition and is only developed within pregnant women who were not predisposed to diabetes earlier. This occurs in about 18% of pregnancies, and this is caused when the hormones produced by the placenta becomes resistant to the hormone insulin. Most of the insulin within a woman's body during this time is not used efficiently. And after pregnancy, gestational diabetes essentially goes away, but could present future health issues, such as the mother being at a higher risk of type 2 diabetes. Children born from a woman who had gestational diabetes will eventually develop type 2 diabetes or obesity. And lastly, infants, while they are in the womb, will have issues of microsomia, hypoglycemia, and respiratory distress syndrome. Symptoms of gestational diabetes are very rare in terms of showing and presenting themselves. They can be asymptomatic, but the most common symptoms listed will be high levels of sugar within the urine, which can be obtained by the doctor during the weekly checks, unusual thirst, frequent urination, fatigue, nausea, frequent vaginal, bladder, and skin infections, and the severe all blurred vision. Modifiable risk factors of gestational diabetes can range from unhealthy eating habits, such as consuming foods with high levels of sugar, so high carbohydrates, having little to no education on adequate healthy food options. This can also be a sedentary lifestyle. Gestational diabetes within women who are also obese tend to not work out or live within regions that have access to a gym or a healthcare facility. Inconsistent monitoring of blood sugar levels within the body and the urine. And lastly, weight. Many pregnant women who are overweight and obese are at a higher risk of gestational diabetes than pregnant women without. Non modifiable risk factors are within four categories: genetics, race and ethnicity, socioeconomical, and mental health. For genetics, if a woman had diabetes previously, they are at higher risk. If they had a high blood pressure or high cholesterol, or suffer from polycystic ovary syndrome, they generally have a higher risk of GD. African American women and minorities are at a disproportionately higher risk of having gestational diabetes than the white counterparts. Socioeconomical factors such as food deserts, areas where there are no access to fresh fruits and vegetables, minimum wage jobs, unemployment, lack of education, poverty, lack of health insurance, healthcare bias, and unrealistic postnatal body norms are at higher risk of women dealing with gestational diabetes. Lack of education is usually the highest socioeconomical risk factor, given that a lot of women are not aware of their resources and what they can use to target their high blood sugar levels and essentially mediate the symptoms and condition. And lastly, mental health, cultural and custom beliefs. Many women who have set cultural beliefs tend to not adjust their lifestyles, their eating habits, given that they believe differently. High levels of stress, social media outlets consistently seeing advertisements for food or for unrealistic body issues can cause mental decline in pregnant women, making them more susceptible to GD. And then, of course, depression. So, GD and the comorbidity obesity within African American women, using the chart seen to the right, it is clearly noted that African American women have a higher rate of obesity amongst the other racial groups. 60% of Black women are considered obese according to the BMI scale, which is inadequately curated, disregarding the body masses of Black men and women. On this chart, we see that non-Hispanic Black adults as a total have a higher age-adjusted prevalence of obesity at 49.6%. When comparing women, we see that non-Hispanic Black women have the highest age-adjusted prevalence rate of obesity at 56.9%. This map shown on the screen gives us an outline of diabetes and obesity within the US from the year 2016. The key in the lower right corner is showing us that we're going up from low to middle to high for diabetes percentage rates, and then low to middle to high for obesity percentage rates. We can see that the mid and central west regions have a higher rate of obesity, and we see that the southeastern side of the United States have higher rates of diabetes as well as obesity. So this shows the areas that have the higher low economic status communities who are more susceptible to these conditions. So statistics of African American women in comparison to their counterparts, we see that every year 2 to 10% of pregnancies within the United States are affected by gestational diabetes. On this chart, a table viewed, we see that American Indians have a higher percentage of diabetes at 14.7%, and then non-Hispanic Blacks have a percentage of 11.7%. Although Asian and Hispanic women do experience higher rates of gestational diabetes, to where Black women are unfortunately 2 to 6 times more likely to die due to complications during pregnancy, given their diabetes condition. So, a few prevention programs for gestational diabetes will be screening. This usually takes place between the 24th and 28th gestational week of pregnancy. doctors will administer an oral glucose tolerance test, testing for the higher levels of blood glucose levels. Between the 24th and 28th week of pregnancy, the placenta produces large amounts of hormones that may cause insulin resistance. A few prevention programs in place to target this is Diabetes Prevention Program by the CDC. They focus on education and providing resources to women affected by diabetes. We also have the Black Women for Wellness. This company focuses on outreach, education, resources, and any other additional assistances pregnant women, Black pregnant women need for. So the risk and vulnerability of COVID-19 were slightly less than other conditions. Because gestational diabetes is an immunocompromised condition, women had a higher incidence for development of birth defects during their first trimester. Additionally, they had a higher risk of respiratory infections and mortality. Given the recent levels of COVID-19 infections, we had a higher rate of miscarriages and stillborn births. To prevent COVID-19, many women would have to maintain their insulin levels, so they will continually check their blood glucose, their blood levels. They should also continually check to make sure that they have enough insulin on stock. They need to have adequate sleeping and physical exercise. They have to maintain a low carbohydrate diet to not spike the blood glucose levels. And they need to maintain reduction of stress levels so that they are not at a higher risk of COVID-19 in comparison to other women. Communication strategy to provide the necessary education for pregnant women will be social media. Social media utilizes bot ads that can be advertised across Facebook, Twitter, Instagram, and YouTube to provide pertinent health information. The content that will be discussed will be on nutrition, exercise, monitoring blood glucose levels, and education. Women who are within their third trimester having gestational diabetes and being obese will more than likely be on bed rest. Therefore, they will be limited to most of the requirements to lower their blood glucose levels. So social media to me seems to be the more obvious choice to provide and relay that impertinent information. So management of gestational diabetes will be an increased physical activity, lifestyle, healthier diet habits, additionally using increased social support from family and friends, communication with healthcare professionals to ensure that they have all the information needed to move forward. They need to maintain a treatment plan prescribed by the doctor so that they do not fall behind and have an increase in blood levels. They need to utilize government funding if minimum wage and low employment rates are the biggest issues within the community, then leaning on government funding will be more beneficial during these times. And lastly, potentially joining nutrition classes to educate themselves on nutrition and how to correctly prepare food and portion sizes. Given that diabetes is a chronic condition, utilizing the social determinants of health will help abate the symptoms of diabetes and to maintain a healthier lifestyle. And these are the citations that I used during this PowerPoint slide. Thank you.